Hello, I'm Morgan Van Blarcom. I'm here to discuss Achoo, Avoid the Flu, which is a school-based intervention program focused on distributing flu vaccines for students and faculty, and also educating schools about the best ways to avoid the flu. Flu season begins in the fall, so education for proper hand washing for the students will begin taking place in September. Education on the vaccines themselves will also begin then. Pamphlets will be sent home to parents explaining the importance of vaccines, how safe they are, and why they're needed. Flyers can be posted around the schools, in the hallways, in the bathrooms, reminding students how to wash their hands properly and frequently. During October, free vaccinations will be given to the faculty, staff, and students who have their consent signed from their parents. Rewards can be given to the students either individually or as a group to give incentives to get them to receive their vaccinations. Some studies show that incentives to an entire group rather than individual may work better for competitions. Hand washing can be encouraged throughout the school year. Tissues can be made available in all the classrooms. Staff will also be educated on how to properly disinfect all the areas that are frequently touched that the flu might be spread on. So this would be like doorknobs, sinks, anything that the students share, scissors, art supplies, things like that. This program will be implemented through each county in the state. We're hoping that absenteeism in the students and faculty will be reduced. So to measure that, will be recorded and we'll compare it to previous years, along with other counties that don't have programs. So we'll compare it to those. Surveys before the education starts for the students and parents can be given out, and also after education is completed and the program is done at the end of the year. Also, if funds allow, we would like to get laboratory confirmation of positive flu testing for students that have not come to school. The information that we'll have will be compiled and studied to learn how effective the program was and what could be done to improve it. Then the report will be sent out and made public. For our needs assessment, we have learned 5 to 20% of the population get the flu every year in the United States. The vaccine is recommended for people over the age of 6 months old. There's different types of vaccines for different age groups. Some recommend children under 6 who have not yet received the vaccine receive 2 doses of it in different time increments. The flu, more than any other preventable disease, causes children to be hospitalized every year. So this can be prevented, so we can reduce hospitalization stays for these children and hopefully reduce the number of days they miss from school. School-located vaccine programs have been shown to help those who cannot afford vaccines or whose insurance does not pay for it. Programs for other health issues have been in schools for years. Programs for physical activity, nutrition, drug abuse, sex ed, all of those are already implemented in schools, but there's very few programs existing for infection control and prevention. In particular, diseases like the flu that spread very quickly in schools. Our action planning for intervention strategies begins with learning more. We need to learn more about the school facilities themselves, what they have available for us to use to be able to put this plan into action. So like auditoriums or gymnasiums, do they have the space for us to actually give the vaccinations to a large group of people all at the same time? Also, we need to get to know the administration of the schools, learn who we need to talk to, who is going to help us organize these programs. School nurses can also be very beneficial to programs like this. They not only can they help administer the vaccines and help control the children, so they know some of the children, so they're going to be able to calm them down if they're scared of needles or anything. But also the parents trust the school nurses in the schools already, so that can be a big help in convincing the parents that the vaccines are good and useful. We also need to understand that each school is going to be different in the best hours for the program to take place. The program can either take place during school hours or after. It just depends on the school you're working with, maybe the different age group you're working with as well. Also, schools can help provide volunteers, parent volunteers, other school volunteers that may be able to help us with the vaccination program. Our goal for this program is to reduce the number of influenza cases for students and faculty and to educate on the flu and also infection control in general. Our objective is to reduce absenteeism in schools due to the flu with school-located vaccinating programs. Influences that are very important when you are discussing vaccines. Parental influence is very, very important. If the parents don't want their children to get the vaccines, or they don't believe in them, or they just don't want to do them, that can be a huge impact because they have to have consent because most of the kids will be under 18. Also, education for the parents will be given out, so hopefully this can help influence the parents to understand why it's so important. Peer influence is also a big factor, especially among middle school and high school students. If your friends are getting the flu vaccine, you don't want to be left out, so you might want to get it too. So this is also another thing we want to take into account when we're developing the program, trying to get the students involved, getting their peers involved so they can convince each other that the flu vaccine is a good thing to have. Culture influence is also a big thing. Religion and culture can impact how people perceive vaccinations in general or Western medicine altogether. Allergies is also another thing you have to take into account because many of the flu vaccines, not all of them, but most of them are made with eggs, and some people are allergic to eggs, so that has to be taken into account for children who have allergies to eggs. Our logic model starts with educate, vaccinate, hygiene, prevent, and avoid the flu. Be healthy. So education on how the flu works, the vaccine and how it works, its safety and how it is. Also on how the hygiene works, what needs to be cleaned, disinfected. Actually getting the people vaccinated, getting them to do the hygiene, and preventing the flu. Resources that we should have available to us, the school facilities, like I mentioned before, the auditorium, gymnasiums, school staff, volunteers from the school and outside help, other the health department or other possible places you can find volunteers. Local hospitals are also a big thing. They can help supply medical equipment, alcohol pads, or any Band-Aids. They can also help actually supply the flu vaccines themselves. Medical students are also a very big asset in some of the programs we have in this area already. Nursing students from local colleges will come and give flu vaccines. So that can help get the process going faster in schools when you have more people giving the vaccines at one time. Government funding and local funding is a very big deal because supplies can be costly. The program itself, other than the medical supplies, should not be too expensive because it's mostly just education. So once we get people in there to educate, volunteers and people from the program, it shouldn't be too expensive. For the cost of the vaccines, the CDC has a list of different types of vaccines, different name brands, and different price ranges. So for children 4 years and up, we have a price range of $6.93 to $15.23. Children 9 years old and up cost $6.64 to $12.30, and 18 and over are $7.96 to all the way up to $32.95. This is for 10 doses, so each of those prices will cover 10 doses. The different price ranges that they have are based on the type of vaccine, whether it is an injection or is it a nasal spray, how is it made, and also the manufacturer. So other costs that we'll run into will be any incentives that we try to use if we do anything for the children individually or as groups, if we want to supply them with the school with the highest percentage of vaccinations gets any kind of prize, then that will be something that will have to cost, or we can, hopefully we would be able to get donated from local companies and businesses. Papers for the flyers and consents and pamphlets that we will send home, and other medical supplies, which hopefully we could get from local hospitals. To implement this intervention, we will start with education. We want to educate with pamphlets, also face-to-face instruction on hygiene, the flu virus, and we'll try and hit parents, guardians, and the faculty. Students will probably get more face-to-face than the faculty or the guardians. The guardians will get the pamphlets that we send home, along with the consents and any other information we can give them, links to online sources and other things. The staff at each school needs to be trained properly to disinfect areas that are high traffic and high for carrying the flu virus, so doorknobs, anything that the children share in bathrooms and things. It's very important that these get cleaned, because even if they're not cleaned properly, then they can still spread the flu around. We have to get parental consent for the vaccination for the children, and then hopefully we'll just give them the vaccinations. Our timeline for this will run from September to April. September is when we will begin all of the education for everyone, and we'll also give initial surveys out. The surveys will include what they already know about the flu, what they already know about the flu vaccine, and they will be tailored to different age groups. We want to get the students involved in spreading the word and showing their support for the vaccination program. We have to send home consent forms and also informational packets. We have incentives for the school to compete to get the highest rate of vaccination, and we want to start to encourage proper hand hygiene and disinfection of the school. That's where we will also post flyers in the bathrooms and the hallways to try and remind children and get the faculty to encourage them to wash their hands as much as possible. In October, that's when we will plan on actually giving the vaccinations to those that have brought in consent. October through April is when we'll begin to monitor absenteeism and hopefully offer flu testing to those who have respiratory symptoms when they are out of school. We also want to continue the hygiene and disinfection throughout the whole year. In April, we'll kind of tie everything together, and we will give the final survey, what they've learned from the program, if they've been affected by the program, if they ended up with the flu or not. And then we will also compile all this data that we collected throughout the whole program. To evaluate the intervention program, we will do the pre-post program surveys for the participants, including the students and the full school's faculty. We'll compare the absenteeism in previous years and in schools that aren't using the vaccination program. We will get laboratory confirmation testing, hopefully for the flu, with support from local hospitals. We will analyze all the data from schools with and without vaccination programs. Once we analyze all the data, we will consolidate it, write a report, send it out to all our stakeholders, and make it public. We will make changes to improve the program based on the evaluation results. Thank you.